Good afternoon. Welcome to the weekly update at the St. Clair County EMA office for day 656. And for those of you who are keeping track, week 29. I'm joined here with Chairman Mark Kern of the County Board and also Mila Blanford from the Health Department. Mila, the numbers are there and you have them today. And
I do. They're not great. So for the reporting period of December the 23rd through the 29th, we have a total of 1,552 new positive tests out of a total of 9,305 for the reporting period. The age range of those individuals is under 1 to in their 90s. The weekly county positivity rate is at 16.7% with the 7-day rolling average match at 16.7%. The regional positivity rate as of December the 26th was at 12.1%. Our case rate in St. Clair County is 435 per 100,000, which is high. Anything over 100 per 100,000 is considered high for transmission. Unfortunately, we have one new death to report, a female in her 60s with underlying health conditions. Countywide, we have conducted a total of 614,873 tests, consisting of 47,313 positives and 560 negatives. The total number of deaths to date is at 597, and our condolences go out to those families. To date, the number of individuals who've completed their 10-day isolation period is at 44,766. Statewide, we have tested a total of 44,273,181. Total positive of that number is 2,119,162, which is an increase of 116,802 from last week. Total deaths to date is 27,734, and that's an increase of 377 from last week. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County is 90. Regionally, we're at 199. Patients on ventilators in St. Clair County is 9. Regionally, we're at 25. And if Randy, if you could share the graphic from our hospitals, you can see that we have 90 hospitalized patients in St. Clair County. We were at 66 this time last week. Around 77% of those individuals currently in the hospital with COVID-like illness are unvaccinated. We have 17 currently in the ICU. Last week we were at 11. Currently 14 of those individuals, or 82%, are unvaccinated. We have 9 patients on ventilators. We were at 4 last week. And about 78% of those individuals are unvaccinated. And if you'd like to switch over to the age breakdown, you can see that currently we have about 12% that are 10 and under. Last week we were around 17, so a little bit lower number in that lower age category. For the 20 and under age range, we're at 26%, and cumulatively we're at 62% for those that are 40 and under. So that's similar to what the age breakdown was for last week. Okay. For congregate care, announcing those in outbreak status with new cases: Brea Belleville, 2 new cases; Cambridge House of O'Fallon, 1 new case; Cedar Ridge of Lebanon, 13 new cases; Freeburg Care Center, 1 new case; New Athens, 1 new case; and Willow Creek of Belleville, 1 new case. Okay. So we've seen an increase in cases across the state, as well as an increase in demand for testing. If you are seeking solely testing services, please do not go to an ER for those types of services. If you have an emergent health need, of course, seek out medical care. But if you are only looking for testing services, please consider going to one of our local testing centers. St. Clair Square Mall is now open Monday through Saturday from 8 to 4, offering testing services. They have vaccine Monday, Wednesday, Friday, and Saturday from 8 to 4. In addition, they will be closed this coming Saturday on the 1st. We offer vaccine at 330 West Main Monday through Saturday. We will be closed Friday and Saturday for the holiday, but that's Monday through Friday from 10 to 6 and Saturday from 8 to 4. There are several new things coming up that you can check our website for. Currently, IDPH has Vax Verify, so if you've lost your vaccination card or any immunization record, you can go to Vax Verify, and you can Google that, or we have the information on our website. You can print all of your immunization records. They have added a Smart Card tab, so you can print specifically your COVID vaccination records with the QR code. So if you're going anywhere that requires documentation of vaccine, you can present that QR code. And again, there's more information on the Health Department's website and social media. In addition, CDC has issued new recommendations for isolation and quarantine. IDPH is currently reviewing those, and once they adopt those, we will implement them at the local level. So more to come on that. Again, we have those guidelines listed. And then IDPH is also moving to a centralized contact tracing system. So what that will look like now for cases, you'll receive a text message from the state with the phone number and website for more information. As we move through January, all those efforts will be directed to our state centralized program, and the local health departments will be involved in outbreak contact tracing for schools and long-term care. But again, there's more to come on that, and you can check our website for details. In addition to the mall, we also have testing at CVS, MedExpress, other providers within the county. All of that information is on our website. Mark?
Okay, thank you, Mila. You know, big numbers. I think the big message is if you haven't been vaccinated, get vaccinated.
Right. That is the best tool we have in our tool belt. We keep saying that. Get vaccinated, get boosted once you're eligible. Wear a mask, stay socially distanced, especially in crowds when you're not sure people's vaccination status. Wash your hands. And that works not only for COVID, for the different variants, it works for flu and other respiratory illness. We know in the winter months we've seen an increase in all respiratory illnesses. So it's good advice just across the board.
And the highest numbers that we saw, and really not that much higher, last January 3rd, I think, Herb, was our highest hospitalization day, came after Christmas, New Year's gathering. So
Right.
people should gather with people who they know their status.
Mm-hmm.
Isn't that the key?
Yes, it is. And if you want to know, go be tested before you go to those family functions and those group outings. Again, that's why those services are out there. We've expanded that capacity in St. Clair County, and we hope that everybody takes advantage of that.
Great. Thank you, Mila. We've been here a long time,
We have.
and it looks like we're going to be here for a while longer. Let's look at the zip code report today. Big changes in the wrong way in every St. Clair County zip code today. 62059 in the past week has gone up 11 to 76. 62201 is up 31 to 976. 62203 up 47 to 1077. 62204 up 29 to 735. 62205 up 54 to 1136. 62206 up 73 to 2312. 62207 up 43 to 1171. 62208 up 129 to 2797. 62220 up 104 to 3317. 62221 up 166 to 4,484. 62223 up 81 to 2,856. 62225 up 27 to 356. 62226 up 179 to 5,052. 62232 up 36 to 1,416. 62239 up 33 to 839. 62240 up 10 to 278. 62243 up 34 to 1,127. 62254 up 27 to 1,133. 62255 up 4 to 154. 62257 up 20 to 547. 62258 up 43 to 1,656. 62260 up 53 to 1,179. 62264 up 36 to 606. 62269 up 223 today to 5,442. 62282 up 2 to 92. 62285 up 37 to 869. And 62289 up 8 to 84. Regional positivity up today to 12.1%, and the 7-day rolling average is up now to 16.7%. The highest it's been in a long, long time, almost doubled from where we were 7 or 8 days ago. So these numbers are really skyrocketing right now. It's a time when we need to kind of think about how we were a year ago. We took a lot of precautions. We were able to stem the tide of COVID at that time, start to move in the right direction. It's time to kind of think about what we did back then and make sure we're still doing that today. Get vaccinated, get your booster, wash your hands, wear a mask, try to stay in social settings that are somewhat smaller, in a crowd where you know the people you're dealing with and know what their status is.
Well, and you know, Chairman, when you look at the numbers that Mila and you reported today, it doesn't take a rocket scientist to know that these numbers are going up. And you said that at the beginning, they're going in the wrong direction. Every zip code in St. Clair County, 27 of them all have increases. We're back to showing that there is definitely community spread out there. And as Mila said, our best defense is being vaccinated. We've ordered, at your request, more masks that we're going to be getting in here by January the 3rd. So we'll make sure we have plenty of them on, because that is proven to be another defense that we can have. And so we'll be keeping everybody updated on that. The state announced today that the driver's license the department's going to be shut down until the middle of January. So we don't want to continue going backwards. So we got to put the brakes on this thing. And it takes each and every one of you out there to do that. And we've said that now for 22 months, I think, is what we figured up. And we're here. We're going to be here. We're not going anywhere.
And talk about hospital capacities right now, so people are aware. The hospitals in St. Clair County are getting very close to being being full. So at the highest point ever, we had 125 people in the hospital with COVID. We're at 90 today.
Yep.
We know there are people currently who are in the waiting to get into ICU.
Yeah.
They're in the emergency room. These are beds that are available right now, but they're slowly getting to a point where you're not going to have capacity. So we've got to stem this tide.
Well, and there may be some that says, well, you know, okay, what's the big deal? But, you know, these hospitals, our first responders are not only treating people with symptoms of COVID, they're treating auto accidents, they're treating heart attacks, diabetics that need beds in these hospitals. We don't want to get back where we were a year ago, where our hospitals were, I mean, our ER staffs, our nursing staff, everybody is maxed. They are still fatigued. So it's each and every one of our responsibility to take what tools we have. And right now, you've heard Mila say it, you've heard the doctor say it, you've heard the scientists say it. We're going to keep preaching it. The best form of defense we have right now is to get vaccinated. And then, yeah, there are people out there that's going to say, well, I know so-and-so that got vaccinated and they were boosted and they still got it. Yes, there is nothing 100%, but probably the person that you know that got it didn't get a severe case of it. Had they not been vaccinated, boosted, the story could have been a little bit different. So we're here. We're going to continue to be here. We'll let you know of any future developments that take place over the next week if something comes up in between. As always, we will come in. Mila, there was one question that come in, and I think it's important for the health department about the schools. And Marissa, they're having problems getting children up to get them vaccinated. And
Okay.
there person's asking, is there any way the health department can address this, maybe come with some type of mobile system?
We do have IDPH mobile units and go out and provide vaccines, so we will reach out. Thank you for that information.
Good. And for one of Noella is one of our followers every week, and we appreciate that comment. And Mila will get that addressed for you, hopefully. We'll see you back here next Wednesday, unless something comes up in between time. Everybody have a good evening and a Happy New Year. Be sure to know who you're around. Be safe out there. That's how we're going to get ahead of this thing. Thank you.